Infant malrotation. Intestinal malrotation in infants is a congenital condition where the intestines do not rotate properly during fetal development, leading to abnormal positioning of the intestines in the abdomen. This can cause serious complications, including bowel obstruction and volvulus, twisting of the intestines, which may lead to a lack of blood flow to the intestines and is considered a medical emergency. Key facts about malrotation in infants. Causes. Occurs during embryonic development when the intestines fail to rotate 270 degrees around the superior mesenteric artery as they return to the abdominal cavity. The exact cause is unknown, but it is not typically linked to genetic or environmental factors. Symptoms. Symptoms of malrotation can present in the newborn period or later in infancy and may include bilious vomiting, greenish or yellow vomit, a key warning sign of volvulus, abdominal pain or swelling, bloody stools or lack of bowel movements, feeding intolerance, signs of dehydration or shock in severe cases. Complications. Midgut volvulus. The intestines twist around themselves, cutting off blood supply and leading to necrosis, tissue death if untreated. Bowel obstruction. Narrowing of the intestines or blockage due to the abnormal positioning. Diagnosis. 4. Step bowel obstruction diet. For the nutritional management of bowel obstruction related to cancer. Who is this advice for? The information in this advice sheet is for you if you have been diagnosed with bowel obstruction, are at risk of developing bowel obstruction, have a mass in your small or large intestine, bowel, and are at risk of a blockage, have delayed emptying of the stomach. What information is provided here? Why is it important to eat the right sort of foods? How to use this information. The 4-step bowel obstruction diet. Step 1. Clear fluids only. Step 2. All thin liquids. Step 3. Smooth and pureed low-fiber foods. Step 4. Soft, sloppy, low-fiber foods. After Step 4. References. Further reading. Intestinal malrotation is a birth defect that occurs when the intestines don't move into the correct position in the abdomen. The treatment for intestinal malrotation is usually surgery to realign the intestines. When to operate. Surgery is usually required, and the timing depends on the child's condition. If there is a volvulus, surgery is necessary immediately to prevent bowel damage. What the surgeon does. The surgeon will untwist the intestines, reposition them, and check for healthy tissue. The surgeon may also remove the appendix to prevent appendicitis. Recovery. Most babies recover well and make a full recovery. Recovery time varies by baby and depends on factors like how quickly the intestines heal. Risks. There are some risks associated with the surgery, including bleeding, infection, and adhesions. Adhesions are bands of tissue that can block the bowel and may require another operation. Long-term outlook. If surgery is performed before intestinal damage, there are usually no long-term problems. However, if a large portion of the intestine is removed, the digestive process may be severely affected. Symptoms of intestinal malrotation include vomiting, diarrhea, abdominal pain and swelling, and bile vomiting.